All right, welcome to your boardroom. I'd like to call the meeting to order and ask the clerk to call the roll.
Supervisor Zaragoza?
Here.
Supervisor Long?
Here.
Supervisor Huber?
Here.
Supervisor Parks?
Here.
Supervisor Bennett?
Here, would you please stand and join me for the Pledge of Allegiance? Hand over heart, ready, begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, we're here to conduct the Ventura County hearing on the adoption of the fiscal year 2019-20 budget and to receive public testimony. The budget times are scheduled at 1:30 and also public testimony at 6 p.m. this evening. The hearing will continue on a daily basis and must be completed within 14 calendar days if not approved. I might point out, in my lifetime, we've certainly never done that. This is the official opening, which is why I have to read all of this attached information. A public hearing of fiscal year 2019-20 recommended budgets for the County General Fund, the Fire Protection District, the Watershed Protection District, the Waterworks District, the county service areas, and non-general fund activities under control of the Board of Supervisors is now open for public comment from departments and agencies. And with that opening statement done, I'll turn it over to Mr. Powers for agenda review.
Thank you, Chair Bennett. Board members, yes, on item 6, CEO's office, public hearings regarding adoption of the fiscal year 2019-20 budgets for the County of Ventura. A board letter, exhibits 1 through 3, fiscal year 2019-20 preliminary and recommended budgets have been submitted.
All right. And we have...
and with that, we'll start on our... motion.
Well, yeah, I was going to say, we have a motion to approve our agenda, and I think we go to this before.
We come in first.
And staff report. Got it. Good. Okay. Great. All right. So we're voting on our agenda. And Ms. Mann, for your first budget presentation.
Yes. Good afternoon. Kay Mann from the CEO's office. So here is our order of events.
Oh, good, thanks.
We are on number 2, our opening comments and staff report, followed by the hearing at 6 p.m. and budget deliberations. So you've seen these before in terms of our guiding principles as we adopt the budget. We use the board-established priorities that are in the strategic plan: openness with the community, delivering county services efficiently and effectively, and with long-term fiscal discipline.
I'm just going to interrupt for a second here. Go ahead, Mr. Powers. All right. Danny Carrillo and Lisa Cody, are you going to be speaking on budget items? Right, so you'll be after this, not during public comment. All right, it was listed under public comment here. Thank you very much. Great. Thank you. All right, sorry to interrupt.
All good. So one just comment on this is the process, and sometimes we get to this afternoon and there's not a lot of presentations and so forth, but there's a reason for that, as your board and all of our leadership out here knows, and that's because the budget process goes on for about 6 months. And here you can see all the work that goes on into working with the departments to develop the target budgets, meeting with the departments, the general fund capital projects and debt presentation that happens in advance, as well as the department budget presentations that happen in the weeks and months before this day. So there's a long process that goes on to get to this point. It's more than just because we felt like way in the past, if you did all these departments at one time, it's just too much information to process in one afternoon. So that's the context for it. And then, of course, the preliminary budget presented June 4th, and here we are today for the final hearings. Thank you.
So this is just a recap of what was presented to your board on June 4th as part of the preliminary budget, with our total recommended budget at 2.33 billion and it was 59.3 million increase from 1819 adopted. Our general fund appropriations were 1.13, and our general purpose revenue 437 million. And again, the preliminary budget maintained most services at the current levels, and full-time equivalents at that point were just a little over 9 million. So we have a structurally balanced budget that was presented to your board. Again, reserves were increased, and again, reserves are not used for ongoing operations, but only to fund one-time activity. We had continued investment in infrastructure and technology, and that reinforces our very high credit rating. So 2.3 billion was the preliminary budget, and since then, there are a number of post-preliminary adjustments due to timing that did not get into the preliminary budget, and we are now at 2.309 billion in terms of our budget. So for the general fund, the post-preliminary adjustments, appropriations, 8.8 million, and revenue of 5.5, for a net county cost of 3.3 million. And for the non-general funds, 3.6 million of appropriations were added. Here's the detail of those post-preliminary adjustments. In the general fund, we added $10,000 in probation's budget to provide youth services at the Colonial Library. There was $3.4 million increase in special accounts and contributions, $1.5 million, the one-time contribution to Westminster Free Clinic, $1.8 million for contribution to the Public Works Road Fund for bike lane projects, $25,000 contribution to library services. That was to match the city of Fillmore's $25,000 contribution, $30,000 for the Lewis Road barn facility schematic design, and $60,000 for equipment purchases for the search and rescue teams. There was $1.4 million added in capital projects. That was just an adjustment related to our final pricing of our trans. That increased our debt service by $3.9 million, but we had $5.4 million of offsetting revenue due to the way that the trans was actually structured for the $1.4 million addition to our capital projects. For non-general funds, there was an increase of $50,000 contribution to the library, $25,000 from the city of Fillmore, as I mentioned earlier, and $25,000 general fund match. Again, the $1.8 million contribution to Public Works for bike lane projects, and another $1.7 million increase in VCMC for the revised staffing adjustments. And we had a number of FTE adjustments as well in the general fund, as you can see. And for the non-general funds, it was a reduction of 193 FTEs in VCMC. It's 81 for the reduction in force in terms of FTE, and another 112 for the vacant positions that they deleted back in May, which did not make it into the preliminary budget due to timing. Some information on the Westminster Free Clinic as you had requested.
Good afternoon, Board. Scott Powers, County Executive Office, Supervisor. Chair Bennett, Mr. Powers, on May 21st, your board directed our office to provide some analysis on the Westminster Free Clinic and the opportunity to invest funds into next year's budget. This analysis was put together by myself, Mr. Robert Bravo, and James Importante from our office. We just a few brief slides. We looked at their financials, including their profit and loss, income statements, and their budget, and found 2/3 of their budget is primarily donated goods and services, namely volunteer hours supporting the clinic. Another third is the operating budget, which is primarily the revenue sources from those are from over 20 different foundations that they generate grant monies from, in addition to government funding and CDBG funds and TSP funds as well. And we've met with some of those organizations and the VCCF and the Westminster and found several opportunities for the West County foundations, for the foundations to be providing funding for the West County operation as well in the future. We also found that their financials to be structurally very sound, and we've come to your board a couple of times with reporting on nonprofits in the past, and we're very surprised and impressed with their financials in terms of debt, in terms of their reserves too. So we were very satisfied with that information. And in terms of opportunities to apply, we looked at several of these and found that one of the greatest opportunities that they're not a startup. They've been around for over 20 years and have been performing well for 20 years. So they already have that foundational element to them. And we've seen a lot of opportunity in the West County, especially, as you can guess, for the to serve those people. And also, in terms of the need, we looked at some public health data from 2019, which is a socio needs index, which kind of measures poor health outcomes compared with socioeconomic needs, and found the greatest need to be in the zip code of 93033, which is Oxnard. Of the 47 zip codes, that's the greatest need for this service to be located. And in meeting with the VCCF, we found significant opportunities in the future to partner for those two organizations to partner for future funding grant opportunities that VCCF can help them with. So in terms of challenges, we looked at, what's the biggest issue, and really it's going to be location and size of a building and the opportunity to find a donor, whether it's a nonprofit or what have you, to offer that type of facility. We're looking at a 15,000 square foot facility, maybe larger for that capacity there. But that's going to be the greatest need out there in the city of Oxnard, and also outreach.
Mr. Chair, Mr. Powers, I think we might have found one over in El Rio too, a church that might help us out with it. We might end up with a couple of churches that are going to help us with the facilities, and I think it's going to be worked out pretty good. So we're working with them now at this time.
Great.
And if I might add, I know it's really important for Westminster as well as the county that it not be associated with any kind of religion, and that's
Exactly right.
key.
Even though, it's a church, but they know that too.
Yeah. Our team has come up with a few other opportunities too we'd like to review with you, Supervisor.
Yeah, thank you.
And to conclude, our next steps is to include this funding in the budget, to come back to your board with the agreements necessary to facilitate this funding, also with perhaps measures, metrics to report back to your board on the success of this operation. And third is just seeking the opportunity to help locate a facility, as Supervisor Zaragoza has mentioned, and working with his office and with the Westminster Free Clinic to find the most optimal location for this operation. That concludes. I'm happy to take any more direction from you.
Supervisor Long.
Thank you. I want to question the 1.5. That's a 3-year
Correct.
commitment. And so what's the advantage of providing that 1.5 to VCCF versus having an agreement with Westminster and the county on a 3-year payment program?
Well, this, as kind of I mentioned, this gives the opportunity to incorporate VCCF into this operation a little more than they are now. And in a meeting with their staff, they've identified opportunities outside of Westminster that may be grant opportunities. So providing the funds there kind of starts that momentum towards including them into this operation. It could be in our reserves and we could allocate it over 3 years. This is more of a strategic aspect to that and facilitating that aspect.
So then if it's 1.5 is provided to them, if you're doing a grant match, them having that 1.5, they could utilize that grant match on the program.
Yes.
But if it wouldn't be as successful if it was only 600 or 5 on parts.
That's correct.
Okay. I just wanted to make sure that people understood the reasoning behind it, because I think it's important that they are very transparent of where our money is and how we use it. And with the rules and regulations that are out there. So thank you.
I'd like to, as the person who made the motion for the 1.5 million and brought this board letter, I don't think actually that's the reason. The reason is a board can't obligate a future board. And Westminster, if they're going to start down this road, they need to know they have the 3 years of funding coming, 600,000, 500,000, and 400,000. So we couldn't guarantee that the next Board of Supervisors would vote for the 500,000 or the 400,000. It'd be very likely, but we couldn't guarantee it. But by giving it to Ventura Community Foundation with a contract, and they parcel it out if Westminster Free Clinic does certain things, then this board could allocate the whole 1.5 million, give it to them. So that's the primary reason why we came up with Ventura Community Foundation. Now, an ancillary benefit of that is once we contacted the Ventura Community Foundation, they identified that there are other things they think they can do to help Westminster Free Clinic, and so we now have 2 strong nonprofits kind of feeling more ownership of this project. And so I would offer that the answer that was provided by Mr. Powers is an ancillary secondary reason, and he doesn't know what reason why I came up with that, so I thought I should share that piece of information. I'm trying to make sure that, because Westminster, it's a big leap for them, and they can't take it if they don't have confidence that it's a full 1.5 million. When they got their original grant, it was for a block of money, but they weren't worried. It came over a 3-year period of time, but they weren't worried because it was a foundation that could actually enter into the contract with them. We couldn't do that according to county council, so that's why we set it up that way. So I wanted to pass that on. The other thing is I appreciate your offer to work with Supervisor Zaragoza's office. I went out with Supervisor Zaragoza, and I would like to be involved in the locations, because we looked at that one location, so I'd be curious what the other options are that are out there as you go forward. Really happy that Westminster's request checked out, and really appreciate the professionalism of the CEO's office and you and the staff in terms of doing the review of this. So thank you very much.
And Mr. Chairman, I think Scott said something important, that structurally sound folks in the reserves are really good. They have a good accounting background and structurally sound. I think it's important people understand that. Thank you.
Thank you.
And thank you. Back to Ms. Mann.
So here is our post-preliminary budget as it now stands. And this is for the general fund portion. And we see that the net cost is 440 million. And that is funded by 437 million of general purpose revenue. And 3.3 million is coming from our assigned fund balance. And that completes the funding. And again, we can use, we're using the $3.3 million from our assigned program mitigation to fund the budget, but that is because the 3.3 million is a one-time funding. So we are still in line with our board policy of not funding ongoing operations with one-time funds.
And what is the growth in assessed valuation that we are using for this? What percentage?
3.5 is what we used, but
I know we heard from the assessor, but I just wanted to make sure we're still staying with the conservative 3.5 at this point.
yes,
Great.
we are for now.
Thank you.
We are staying at the 3.5, but as we updated you at the preliminary budget presentation per the assessor's office at the time, it was actually 4.5%, and we just learned today that it's 4.6%. Just in terms of order of magnitude, about 1% equals about 2.7 million.
So it'll keep fluctuating until we get,
Yeah, probably less so.
not so much.
We're pretty close now, I would say. Yeah. The assessor nodded, so it's a good sign. Thank you, Dan.
And we've also, and here's a slide that kind of shows where our reserves or our fund balances are going to be. because we increased our appropriations, we also had to increase our reserves that we have in our unassigned by $765,000. We took it out of assigned program mitigation so that our unassigned is now at $149.8 million, and that still is 13.1% of our budget. And so our net reduction for our assigned is 3.3 million. And again, it just shows where we are at 13.1%.
I'm having trouble reading it. Is that about 2002 there? Right. Okay, thank you.
And yes, that is a negative.
Yeah. Wow.
And this is just an updated slide of the $2.3 billion budget now. The general fund is still at 50%, VCMC at still at around a quarter, and fire at 200 million, 1.143 for the general fund and 1.166 for the non-general fund. And here is how the 1.143 billion for the general fund in terms of appropriations, how it's allocated. 42% admin of justice, health and human services at 39, followed by environmental balance, other general fund and general government. Again, our $437 million of general purpose revenue, that has not changed. And 59% of that 437 funds the net cost of the administration of justice, 13% health and human services. And just our general purpose revenue, 437 million, just the increases over the last few years of adopted budgets. Supervisor Bennett, last time we were here on June 4th, you had asked for a slide of
Thank you.
the 2018-19 FTEs as adopted. And then here is the 1920 FTE positions. And then here are the changes from the 1819 adopted to the 1920 post-preliminary.
This is very helpful. I really appreciate this. I hope we'll do it next year also.
Of
Thank you.
course. We'll make sure we add that in. So key potential future impacts, you've seen this slide before. Again, our capital project needs and our deferred or our required maintenance needs. We'll need to make sure that we revisit those and make sure that in future budgets we are including sufficient funding. Our retirement contributions. Mr. Powers, would you like to say a few words?
I guess I did cue, didn't I? Sorry. The SB 144, there you see, is something that we continue to watch, a very laudable purpose to reduce or eliminate court fees, to put folks on a good path going forward. However, there will be some fiscal impact to that. This has not yet been decided by the, sorry.
I think actually instead of watch, we're actually opposed is what I saw letters for.
Yes, oppose. We are opposing it, but we also are trying to draw a distinction. We're not necessarily opposed to the idea of eliminating the court fees. We just want them to fund it.
Right. I think
That's
that would
the
be
settled-
good
yeah.
to enunciate in our letters too.
Exactly right, yeah. It's sort of like we support with funding kind of a thing, yeah.
The Clean Power Alliance, I think we've heard a little bit about some increase in charges.
On the increase of charges, can we review that? I haven't seen any update on what the charges are. Or do
So
we
yeah, we're going to
have
have
that
Mr. Sasek give a quick summary, if that's okay?
That'd be
Is that
great.
okay? Chair Bennett? Sure.
Right, good afternoon. Chair Bennett, Board, Mr. Powers, for the record, I'm Dave Sasek, the Director of the General Services Agency, and to answer the question, on June 6th, the Clean Power Alliance passed their latest rate increase, and what that did was it affected the larger users of power, in addition to any specific accounts, and those accounts are time of use aid accounts, which are the larger users, and we have a few of those accounts in our county. They're going to see a 27% increase in their winter month rates. Another time of use GS3 account will see a 19% increase during the winter months. The pumping accounts will see a 25% increase during the winter months. And the street lighting accounts will see what equates to a 47% increase in the cost of their power during the entire year. If those are owned by SC Edison, the actual increase that the ratepayer will see is about 13%. If they're owned by us or other users, they would see the full increase of that cost. Fortunately, most of our electric lights are owned by Edison, so we're only going to see about a 13% annualized increase in that cost. And what that really means is total cost of the county of this latest increase is about $690,000. About half of that, $370,000, will be impacted through our rates, our GSA, ISF rates. The rest, the vast majority of that's going to hit Public Works, their pumping accounts for their water districts, and also the streetlight accounts. And there'll be a small increase that the hospital in Santa Paula will hit because one of their meters is one of those time of use meters that'll be increased. So net increase to the county, again, is about 670 for next year. That's the best as we can estimate so far.
Can I ask a question on that? So the board approved moving forward with 100%, and that was a 9 to 10% increase of utility. So then this 13 is in addition to that 9 to 10% cost increase?
The net increase, the dollar value that we calculated is in addition to that, yes.
Okay, thank you.
And if I can, Southern California Edison has admitted to some mistakes that it made in its projections, so it too will be increasing, as you mentioned, its rates. But one of the things that we discovered was that the residential rates have been subsidizing the large users the way Southern California Edison does it. So even like the refineries are being subsidized by residential rates. And the Clean Power Alliance said that no one should be subsidizing anybody. And that's why these rates are higher, because we, in some of the accounts, are large users.
Pretty newsworthy that residents have been subsidizing large private users. Is that what you're saying? All right.
That's exactly what I'm
Southern
saying.
California. So over the years, we've been subsidizing the large private users.
Residents have been subsidizing the large users. That's the way Edison does it. Up in Northern California, it's just the opposite. The large users actually help the residential rates, but Southern California Edison has been different.
Not here.
Well,
It's a different discussion, probably.
yeah, no, I'm just wondering, they pay for it based on if it's water utilities, the residents have to pay for those, or street lights.
Yeah, to discuss.
A jail, things of those natures. It's the residents.
But this is actually how much you pay at home for your electricity is subsidizing oil refineries, large corporations that have, are heavy users. So it's not just.
Right, but I'm talking about the county facilities.
Okay.
So that's
Thank you.
that's what we're trying to discuss is the 9% plus the 13%. And I was just trying to understand where the costs are and how they're going to be charged to our community members as well. Because we have a lot of unincorporated areas where there's homes and residents and so forth. And so that's why I wanted to know.
And our plan, with your board's approval, would be to bring this back in the first quarter to look at the true impact on the departments and address the matter in the budget at that time.
and the true impact on the consumers as well.
Sure.
Yes,
Thank you.
thank you.
And one nice thing is when we do have solar power, which we do in a couple of our facilities like the Todd Road Jail, then we don't have that issue.
Well, and that's why I want us to make sure we're watching it and getting an update. I appreciate having an update on a quarterly basis for this because it is new and they do updates that we don't hear about. So thank you.
Thank you.
Thank you, Mr. Sassy.
So our revenue trends, these are very positive for us. Assessed valuation, as you just heard, RDA revenues increasing, and also our sustainability fee, as we mentioned at the June 4th meeting. These, or rather this slide you've also seen before. We just thought we would just put it out there just as a reminder that these are some of the legislation that may affect our budgets and our public safety departments. On the permanent year on homeless shelter, a funding match for Ventura and Oxnard for Ventura. On June 4th, there was a board letter that provided one-time funding of $830,000 for the Knoll Drive shelter and ongoing costs of $650,000 on an annual basis, which is the county's share. And it's due to open in January 2020, and so half of that, $325,000, has been included in the 1920 budget.
So just a quick question for County Council. When the Oxnard proposal comes forward, assuming it does during the year for the permanent shelter, would that then require a 4/5 vote of the Board of Supervisors? Or does it?
All I know is to make a budget adjustment requires a 4/5 vote.
So it will if it requires a
It's
budget
already
adjustment?
appropriated, it's 3/5.
Right. So is anybody know whether this is going to be already appropriated or?
No, this, no.
It's not an account already, so it will require a 4/5 vote.
Yes, and that's why we wanted to lay out for your board on the shelters, what's in. Ventura, the one-time ongoing is in. Oxnard, they're still finalizing that, so we don't have a firm number yet.
But Mr. Chair, we still have the partnership with
Oh,
Oxnard.
oh, absolutely.
Yeah, I think it's important that we understand that.
And we have money set aside. In the
And we did vote unanimously for the Ventura one, so I
Yeah.
would anticipate that it'll work out. But it's important for us to know. Thanks.
Can I ask a question? So, Mike Powers, we had, as the board approved, or before my time, $3 million for homeless issues. Wasn't that a line item? And is any of this money coming out of that? Because I understood we had decided that it was that money that was left over, I think it was $750,000 or so, was going to be going, or more, was going to be going to homeless, housing for homeless and so forth. So I was wondering if any of this is coming from that?
Part of the 831 was $450,000 of that was from the assigned for homeless, and the remainder came from contingency.
Okay, so there, after the 450, there's no more money that was set aside?
Not in that a specific account, no.
Okay, thank you.
So in summary, your board's direction and support and the collaborative efforts of our employees and management have resulted in a structurally balanced budget, which is what is being presented to you today.
I think it would be good to get a report also just on the amount of homeless funds that are available. I know that we've offered to match other cities, for example, and so just getting an understanding, and certainly that should be a number one priority for us. So the thought that there's zero money is a concern, if that were the case.
Well,
So,
yeah.
I think,
So-
if I may,
Yes.
I think what Supervisor Long is referring to, several years ago, there was money set aside by your board for homeless services. And that's, with this approval today, the balance of what was remaining there will have been expended. All she's referring to is what it was in that pot of money many years ago. There's sufficient assigned one-time reserves to fund the ongoing homeless projects that your board has indicated you'd like to support.
But it's not set aside strictly only for homeless.
No.
Is it?
No, that's
Correct.
no.
So it's a one-time money that's in our budget system. So we, as a board, could state one time, we'd like to fill that line item back up with 3 million or something as a stakeholder there. And then we also have on the budget is not in our board, but a continuum of care. If the governor approves the budget, there'll be money that comes to counties, and then there'll be money that comes to the continuum of care as well. Perhaps, I'm not sure, they're still debating that. But it would be good to get a report back to see where all the money is and how much we have.
And a report on that 3 million. I know in the sense that we did
difference.
put out an offer to the cities that we would help match if they're going to put in a shelter, and 2 cities are taking us up on that in the West County, but I don't know if that, it sounds like that particular fund is gone, but if that's the case, I would still like to have that offer out there.
Well,
And so making
if,
sure we
if,
have
if I,
funds
if
for
I
it.
could, I think we're a little bit mixing things.
Commingling.
Supervisor Kathy Long and myself made a motion to set aside $3 million to match any city that wanted to build a homeless shelter. But that was all that it said, just to build it, not operating. No city took us up on that. So we started tapping that money for other things like the Homeless Prevention Fund and the money for Housing Trust Fund, et cetera. Now we've exhausted that account. And we knew we were exhausting that account. We were down to the 450,000 left. When this board then unanimously supported a new motion that said, we're making an offer to all the cities in Ventura County that we will match 50% of the construction and 50% of the ongoing cost of a new shelter. That offer is still out there, and that offer is backed by the unassigned reserve balance that we have in our unassigned balance. So all of the money in that unassigned balance is potential money that we could tap to do that, and that's why I was asking county council for that. That will require a 4/5 vote to actually take it and, spend it on something. But, so the offer is still out there. Just because the 3 million is gone, I just think that a report on the 3 million would only be a
Can you go
report
back
of
to
what
the
happened in the
reserves
past.
page?
It won't tell us anything about the future. The future commitment is still there, all right, in terms of moving forward. And so that full 72 million in assigned is available. See the 72 million or post preliminary budget 2019 in the second line. That 72 million, we could tap whatever portion of that the board chose to for this.
Just as we could have, when Kathy Long and you made the motion, but we didn't. We could have used that same budget, but we didn't. We've actually put in a.
We actually put it out there
Yes.
because it was our
And
way of
that's what I was
demonstrating.
asking about, and the benefit of doing that. And you're
Well-
saying no one took us up on it, right?
Exactly. Well, number one, no one took us up on it, but also we were capping. We were saying, that's it, $3 million, that's what we're willing to put in. Now we've made a much broader offer to the cities, and that is, not that I'm sure it's giving Mr. Power some pause as I say this, but we made a broader offer, and that is, we can't put a number in because we don't know what the cost is yet. And so far, there's only 2 cities that are actively engaging in the conversation with us, Oxnard.
And that's the partnership we're talking about. Yeah.
Right.
It is positive, I think, as a county government, to be able to continue to do that for the cities and make sure that they understand that it is a priority for us. So that's why I liked, the method of saying we're putting out this money instead of saying, come to us and we'll allocate. That's my preference.
And how are we communicating to the cities that offers out there?
Mr. Powers communicated that both
They know.
to all of the city managers, and we communicated it with a public vote of this board with that offer. And the question would be, if you're going to create a dollar amount, what would that dollar amount be if you wanted to do that? But that's something that we can certainly talk about in the future. So I don't have any problem. I just wanted to make sure that we accurately understood the difference between the 3 million and the new offer that is out there.
Well, this would probably be a good future if we were to do that, to put some aside because for the benefit of budgeting.
At the time that we made the offer,
We don't know how
we
much.
chose not to do that. We chose to just wait and see what happened when cities came, but that was fine. As you're ripping through the slides, can you stop? There you go.
Too late, no.
Close. Could you go back to the 114 position changes, 2019? Yeah, right there. I just want to, I assume that the decrease in 20 in public health and the increase in 21 in mental health, was that a reassignment? So we did reclassification of people from one department to another department?
No.
What was this?
The decrease for public health was a combination of a reduction in funding in terms of grants that they received, and also a reduction in caseload as well.
All right, great, thank you. Okay. We are,
In here.
great. We are at this part of the, we're at this part of the budget where we have an opportunity for departments to comment on their budget. And we have the broad categories up there, and I'm going to do a little change in our culture here. In the past, we called on each department. Instead, I'm going to just call on the general category, and if any department head in that general category would like to comment, please come on up to the podium. But under general government, that's assessor, auditor, controller, board of supervisors, county clerk and recorder, county council, CEO, or treasurer, tax collector. Any of those department heads have any comments that they want to make on the budget, things that we need to know? I want to make this comment myself here as we go through this. We have during budget times, we've had different ways of doing this. I want to make sure that we're aware of any major things that you are not doing that you think are things that we should be paying attention to, things that we can't fund for some reason. I'll give you an example. There was social detox. We weren't doing social detox, and in the budget part of this, we were able to understand that and therefore make plans to start to do something for social detox, which was a big hole out there in our community. So over the course of the next month or so, as these budgets are finished, we'll be reaching out to department heads to ask them about those kinds of things. So I'm going to go on to environmental balance, Ag Commissioner, Animal Services, Public Works, Resource Management Agency. Anybody have anything that you want to mention about the budget after 6 months of negotiating with the CEO? Right?
I would like to make a point just with the Ag Commissioner. Thank you for those positions that we added for the programs that are needed for the community with pest control and so forth. I just wanted to say thank you for doing that.
Okay. All right. Now, Health and Human Services. That's Area Agency on Aging, Healthcare Agency, and Human Services Agency. I see Mr. Foley starting to get up. I wonder why. Good afternoon, Mr. Foley.
Good afternoon. Bill Foley, Director of the Healthcare Agency. Wanted to review with you some modifications to our budget from what was presented 2 weeks ago. And hopefully, do we have slides? Oh, there we go. As you know, we have been working diligently over the past couple of weeks to identify some of the positions that were scheduled to be reduced and evaluating the impact on patient care and services. at our hospitals. And because of that, there are some modifications to the staffing reductions, as well as to our budgeted numbers in terms of expenses and net income. In some cases, it was really understanding, as I mentioned last week, the impact of the movement of people, the bumping, which is based on seniority and people being bumped into positions for which they were not qualified or trained. So we really looked at this on a case-by-case basis. And there are some modifications which I'll review with you. The other major impact is at Santa Paula, where the original plan, in addition to suspending deliveries at Santa Paula, it was also to downsize the number of inpatient beds to 6 ICU beds, which could be used for intensive care as well as general medical surgical care. We took another look at that plan, and working closely with the physicians that are very active at Santa Paula Hospital, we modified the plan so that we could be sure that we're addressing the current demand for services at Santa Paula Hospital for inpatient services. So the plan was modified to 10 medical surgical beds, a 10-bed medical surgical unit, and 4 intensive care beds. The plan is still to suspend deliveries and to continue to operate a emergency department as well as surgery, with the focus being on outpatient surgery, and then the supporting services for radiology, lab, and pharmacy to support those beds and those patients. The total impact in terms of the budgeted loss for fiscal year 1920 is it increases the budgeted loss from what I had presented 2 weeks ago, a loss of roughly 1.3 million to a loss of 3 million. Still a significant improvement over our projected loss of this year, which is $19 million.
Could you explain, is there a relationship with the IPU in that slide with how the accounting's being changed?
I'm sorry?
The top line, inpatient psychiatric unit, are you doing something with that?
No, the
Okay.
inpatient psych
All
unit
right,
is.
thank you.
Yeah, no changes to that.
Bill, can I,
And you are seeing, though, a decrease in the budgeted amount for the inpatient psychiatric unit?
Yes.
And that is accounted for how? Why
Just
is
through efficiencies, staffing efficiencies, but no major changes.
So it's my understanding that they're actually talking about increasing the number of beds in the inpatient psychiatric unit. At the same time, you're looking at a lower budget than last year?
Yes. The lower in terms of the net income.
Mm-hmm.
Yes.
I'm not sure, maybe this too specific, but I had a meeting with some of the individuals that you're working with, and specifically the supply chain staff. It's my understanding that staff is reduced down to a point where they cannot service areas like the operating rooms and so forth because of lack of staff to support those units. For example, if they have, I think you have, 7 operating units or agent, and they can only do 4 or 5 because there's not enough staff to support the supply chain. I mean, no, that's probably too specific, but my understanding is that the staffing is not appropriate for.
Well, I'll definitely look into that. I've not, that has not been reported. And we do have new management of supply chain that have been, very active and in the revised plan. So I'd be very surprised if that.
Yeah, my understanding is that it's been cut something like in half or so,
Yeah, there have been some reductions in supply chain, but not, I don't think really overly significant. And I really question.
That's probably too specific. Maybe we can get together and I can share
Yeah, I'll
some
be
more.
happy to look into that and talk with you about that.
Thank you.
Can I ask a question? So in regards to Santa Paula Hospital with the staffing reduction, I know there's been a lot of community meetings in regards to what the services are going to be there. I would like to ask that we, at least for the board, be provided with some type of update as how our departments are running there, because when I did a listening tour, I was hearing about centralized scheduling and so forth, and want to make sure that if we're doing any optimization, that we're really realizing it. So that if we're suspending OB and we have another surgery room that we could utilize, that we're really utilizing that. So I want to make sure that we're following up for the changes that we are doing, that we are seeing those results.
Yes, we will.
Because what I'm hoping for is that net will be a gain, because we're doing more procedures and so forth that will cover the cost associated with doing business at Santa Paula Hospital.
Yes.
Thank you.
For example, our surgeons have been working with us on a plan to utilize the third operating room at Santa Paula Hospital and to direct more surgical cases there. So we will keep you informed of that. This is a slide I reviewed 2 weeks ago on our budget initiatives to address the loss that both for this year as well as the challenges that we have for next year. The one change on this slide is that the staffing optimization, the budget impact of the staffing optimization is $11.7 million. It was higher than that. It was $13.4 million. I did want to go over a summary of the staffing reductions. And Supervisor Parks, I know you had a question about the number of the layoffs and RIFs, which I'll address as part of this as well. So originally, the total reductions, and this is translated into FTEs, full-time equivalent reductions, was for the agency was 232, and that was a combination of RIFs, which are layoffs, the movement of people laterally, and demotions, the nursing per diems, and extra help, which is part-time staffing in non-nursing departments. With the changes that we've made over the last couple of weeks, the reduction for the agency is now just shy of 194 FTEs. So it's still a sizable reduction. The layoffs, the RIFs are 67, and those are people, because our HR department has done a really fabulous job. During this whole process, they've done an incredible job. If you can imagine, with all the movement and bumping of people and the impact that it has, and then going back and having to make changes, they've been just working around the clock on this. But they've also been working with with the impacted employees. And I think Supervisor Zaragoza, you had commented when I presented the budget 2 weeks ago, asking that we do everything we can for the people impacted. And I'm happy to report that 35 of the 67 people laid off have been offered alternative employment in the county. And we're still working with, with the others. 26 of those 35 have accepted other positions. And this will hopefully continue to improve as we go through the rest of this month.
And we're still working in the 30 days right after that.
Yes,
Good.
June 30th, yes.
Whatever we can do to reduce that down even more so would be great.
Yes.
Thank you.
Yes, and if I may, Mr. Foley, too, so HR staff is working very hard on that. HSA, our Job and Career Center folks are working at that as well. And
Yes.
so in the healthcare agency, but also countywide and other departments, I know our department heads are also looking for opportunities. These are very
Yeah, that's a
talented
great
staff. So,
point.
and then in the private sector as well. So
Yeah, I want to give our
Some-
colleagues in the other departments,
Yeah.
I want to thank them for their efforts as well.
Yeah.
Appreciate that.
Thank you.
So the total reduction, as I mentioned, is just shy of 194. With layoffs, the movement of people, the per diems were reduced as well. Because we really wanted to use the more per diems to adjust for staffing and volume increases. Wanted to break down the what we call VCMS, Ventura County Medical System, which is basically the two hospitals in ambulatory care. The original reduction was to 213, and that is now just shy of 175. You can see the breakdown by, I wanted to show this slide so you can see the breakdown by hospitals. You can see VCMC layoffs of 35, Santa Paula 8, ambulatory 17, and then we break out each of the categories by hospitals and ambulatory. And this is a reconciliation slide that I showed last time, starting with our projected loss of FY19 of 19 million, and then just the changes as we budget for the year in terms of revenue adjustments, increases in salaries, benefits, which would have brought the loss to 47 million if we did nothing. But of course, we're not doing nothing. We've got these initiatives in place, which, as you can see at the bottom of this page, total 44 million, which brings us to the $3 million projected or budgeted deficit for next year.
If I can, we were given the post projections on Friday, and in it is the changes to Ventura County Medical Center. And in the note, it references that it is in line with the changes that were made on June 4th. But actually, we had additional changes on June 11th. So I would hope that between now and when we approve the budget, that is revised to be the June 11th updated numbers, not the June 4th.
Yes.
Thank you.
Yes. Yeah, it will be the most, the most up to date.
So this did come on Friday, and I just noticed that it wasn't including the most recent update. We want to make sure that's in there.
Will do.
Okay, so those are the modifications.
Thank you very much, Mr. Foley.
Thank you.
Anybody else have any questions for Mr. Foley? All righty, we'll go on and we'll have our public comments.
We got a couple more. I'm sorry, Chair Bennett.
Oh.
We have a couple more departments to go through.
No, that's what I'm saying, we'll go on our department.
Oh, I thought you said public comment.
No,
I did have one.
Public comment.
AAA, we went over there. I want to ask Victoria Jump to come down
All right.
real quick. Sorry.
Good afternoon. For the record, Victoria Jump with the Area Agency on Aging. Thank you for the opportunity. Just a quick update. Well, first, thank you for the fixed term positions. That does help a lot. Also, a huge thank you to Sue Hughes and the Hearst Brooks Espinosa team as well. So this year, we were actually facing a reduction in funding from the state, about $250,000. We've been working with the CEO's office on that. But it looks like because of their work with the governor's budget and getting bills passed, that we should have relief. Some of the highlights that as long as the governor doesn't line item them out, some of the things that we're looking at statewide, an additional $17.5 million for senior nutrition. And so for us, that looks like it should be about, $400,000 to $500,000 extra a year, which is, huge, because now we have waiting lists for most of the meal programs. For the fall prevention program, which is something that your board does fund, our fall prevention coordinator, Hannah Beth Jackson put in a budget ask. There's a bill that's going through, but she also put in an ask for $5 million for fall prevention, which would be given out in grants. But the model of the program in statute, once the bill passes, is what Dr. Duncan set up for our county. And so we're trying to push it out statewide and have everybody else have that as well. For our call centers, we have a call center now where people can call and ask for resources. That, the state has finally agreed to provide funding for that. So that will be long-term funding for our call center, about $250,000, which is, great, because that's an additional 2+ bodies that we can put in there. And also for one of our long-term case management programs, that we've been struggling with the state, and that it's becoming more and more of a county responsibility because the state hasn't adjusted the rates. The state has finally agreed to adjust the rates for the next couple of years, and so finally we'll be paid what we should for that program. So if the governor vetoes in it, I'll be working with the CEO's office on that. So any questions?
Well, certainly with the growing aging population we have here in Ventura County, your agency is going to continually increase in importance in terms of delivering services. So it certainly is appropriate that there should be increased funding, hopefully from the state, to recognize that great need we're going to have here in California. So thanks for all the good work that you and your department do.
You're welcome.
And I appreciate the CEO's office help with the state's budget and the governor's office in terms of moving forward. So thank you.
Mr. Chair, and that fall program is extremely important, and you guys do a good job with that. Save a lot of concerns and so forth from the public. So good program.
Thank you.
I agree. I just wanted to say thank you. I know we've been out even to Piru and all over with AAA and just what you do with trying to get more funding for our seniors. And I appreciate all the effort for you and your staff. So thank you.
Thank you.
Thank you very much. All right. I'll repeat again, Health and Human Services Agency. We heard from Healthcare and the Area Agency on Aging, and we have Human Services Agency. All right, so now we're at Administration of Justice, District Attorney, Probation Agency, Public Defender, and Sheriff. Any comments after all the budget discussions?
Mr. Chair, I just want to thank probation again for helping out the Colonia, library with the $10,000. That's going to help a lot of youth out there in Colonia. So thank you for helping out, Mark.
Thank you.
The sheriff for the good work that he's doing for the community. Thank you.
All right.
I had a question. If we require a minimum balance in the litigation account?
See a lot of,
I don't know if there's a requirement. I'm not familiar with one.
County Council, do you know anything about any minimum
And if
balance
that is
requirement?
something that is advisable or not?
I might defer to the auditor controller.
And it's back. I think we budgeted, we're working with the CEO, with the county council on sort of historical needs. It's kind of how we do it. We'll get more information back to you this evening.
Okay, thank
That's
you.
okay. Thank you.
Great. All right, we're at other general funds. That's special accounts and contributions, capital projects, debt service, and required maintenance. Outside of required maintenance, which would be GSA, I think everything else is in the CEO's office there. Any comments?
No updates, only the required maintenance is going from up to 8.5 million. And it's something we're going to be looking at more and more this next year. We've gotten an outside study that's given us some new perspective on what we need to do. So we'll be bringing that to your board coming up.
We have in the past talked about the importance of making sure we had sufficient funding there. So I
Absolutely.
appreciate that that study is coming forward and we can make sure we're not getting behind there and leaving the next generation with big problems. Non-general fund. So under other funds, child support services, Ventura County Library, MHSA, Public Works Road Fund, HSA, that's IHSS, Public Authority Workforce Development. Any comments there?
Mr. Chair, I just want to thank Public Works, and the good work they're doing over in El Rio for helping the folks with water, and it's really worked out pretty good. And also, our road manager, Dave, is doing an excellent job. And Jeff, continue to do good work in Public Works. Thank you.
Okay, thank you.
I would just make a comment on child support services. If Marcus is here, I thought I saw him come in. Where is he? Oh, he's hiding. There he is, behind Chris. Anyway, maybe you could come down just real quick on the call center and how many we have now and some funding and so forth. So they just do remarkable work that's off the radar a little bit.
Good afternoon, Board. Chair Bennett. Well, we are really excited at the Department of Child Support Services. We've been actually handling calls for approximately 20 other LCSAs, and we've been doing that with our own funding. And this year, because of the new governor's budget, the child support program was awarded $56 million, and 500 of that is coming to Ventura County, and it's going to be used for call center services. So we're going to actually be paid for services that we've been providing complimentary, in a sense, for other counties. So we're very, very excited about that. That's going to free up some additional money for us to do some other work in the county.
Great. Thank you very much and welcome aboard.
Yeah.
Appreciate it.
They have as many calls now as about LA County does.
We do.
So it's
31,000
amazing.
calls a month.
And how much funding do you get every year for children in the county total?
We are collecting right about $50 million.
So great work. Thank you.
Thank you.
Great for those children.
Should,
All right. Supervisor Long.
thank you. On HSA, does anyone want to speak in regards to the funding that we're receiving from the governor? Or do we need to revisit that? No? Okay. I just think it's extremely important to understand that that program is getting funded from the state is extremely important, because if not, it would be coming from our general funds account, and it would be IHSS, and it would be utilizing funds that we could then use for other services. And so to put a program together and then mandate it and not fund it is really a problem for us as a county, and to have them be funding it and also be working on the next steps and to be updating that program is really important. And so I just wanted to make sure everyone understands that.
No, you're so right, Supervisor Long. The IHSS budget fix by the governor did a lot. It increased help with the maintenance of effort. It stopped the diversion of growth funding from realignment for public health and mental health, which started small but was going to grow. So essentially that was cutting those programs year after year. That stopped. And so, IHSS is still going to cost more, as things do as you go forward, but the impact will be much more manageable. Before, it would have started in the neighborhood of $2, $3, $4 million a year of general fund dollars that would have taken it away from other county departments. So yes, Supervisor Long, that is a big fix there. There were some adjustments related to collective bargaining, but they won't impact our county because we do have a good long-term agreement with SEO on that. So thank you.
Could we,
Supervisor Parks.
I think this budget year then will be the one where we also look at bringing on the crisis, where we have the crisis sustainability unit and stabilization unit, as well as the expansion of the inpatient psychiatric unit. And if we could have some discussion on that. That's why I was kind of surprised to see the funding actually decreasing over last year. But just looking at, this is the year that I think that's going to take place, right, in terms of the expansion of the IPU?
Yes, the Crisis Stabilization Unit, is that Ms. Milton's led the charge there, and they've started 4 chairs there, and those are pretty full, and the idea is to expand to 8. That's a little bit why the income is down, because the expenses are up a bit, and then the plan is to expand beds as well this year.
And was it 40 beds, I think, in the inpatient psychiatric unit? I don't know if we have someone here to talk on that, or it can wait till later.
What's that? 36. We're going to go from 30 to 36 in the inpatient unit, yeah.
And that's from how many that's currently there?
From 30 to 36 beds.
It's adding 6 more.
Yes.
Okay. I was thinking it was up to 40, but that might be,
They're licensed for 43.
okay.
Okay. All right, enterprise funds, airports, harbor, healthcare agency, VCMC, and Ventura County Healthcare Plan.
Mr. Chair, I'd like to commend our new Airport Agency Director, Kip, and Mr. Rubio. They're doing an excellent job over at the Airport Authority between Oxnard and Camarillo. We have new hangars coming in, we're doing repaving, we're doing a lot of work, in both airports. So I want to commend him, especially Kip. He just took over a couple of weeks ago, and now he's doing a great job for us at the Airport Authority. And of course, Mark Sandoval, I see him out there. He's doing an excellent job in public relations there at the harbor, and he's out there talking to different neighborhoods, different groups, different agencies, businesses, and just doing an excellent job for us at the harbor. So I just want to thank him for that. I'm sure they're here in the public. Mm-hmm.
Great.
Thank you.
Easiest job in the county. Internal service funds, General Service Agency, Information Technology, either department.
If I could ask real quick, on the GSA part, back to the energy, if you could give me a dollar figure as to what the total is with the Clean Power Alliance. We've changed, I heard it was 650,000, but there was an initial increase that we did it. So I just wanted to know what the total is going to be for this coming year.
Sure, again, for the record, Dave Sasek, the total is the 690 plus about 730. So that's about 1.4 million. Public math I'm a little shaky on, but I think that's what about those numbers come out to be. So 1.4, 1.5 million is what we're estimating, the total impact.
Okay, thank you very much. That's a better number for me to understand.
Yes.
Thank you.
All right. We'll go on to special districts, Fire Protection District, Watershed Protection District, and county service areas. Anybody?
Again, Mr. Chair, the fire district's doing a good job for us, and we're approaching, I hate to say, the fire season coming up, but they continue to help us out. And of course, in Watershed, as I mentioned before, is doing an excellent job with our water. And of course, the CSA is also doing a good job. So good job to all the agency directors and managers and supervisors.
I was able to attend a workshop I guess it was on Friday, and really focusing on the needs to be preventative in wildfires, knowing that we have increasing intensity and numbers of them. Things like communication channels and how we can make them more effective, and actually even in our the cell towers and working with our cellular providers.
That's right.
But we did all we lost our communication ability when the power lines went out. So there's a lot to be learned from unfortunately, but a lot to be learned from our disasters. And some of that will require, I think, some additions to infrastructure. So I anticipate with perhaps the after-action reports, we'll be able to put together some real concrete things that we can do to harden our infrastructure. Something to look at.
All righty.
I had a question on the Fire Protection District. I just wanted to understand, first of all, congratulations. I think it's almost a year now for Santa Paula Fire coming in, and all I hear is good things. So I just have to shout out to you guys. It's fabulous, because I know that community was really questioning whether it's good or not, or they could afford it or not. So hoping we can follow up in the next year. But I wanted to just understand posting. So making sure that our budget is for preparing to be there before the fires. Maybe I'm using the wrong word. Dustin's giving me that look like, what the heck is she talking about? Which I get a lot. It was just to make sure if we know that there are certain wind conditions or big heats or things like that, is our budget positioning us so that we could have more people on staff before those big events to really, what's the word I'm trying to look for?
Pre-positioning, disaster preparedness.
Okay, thank you.
Yes, ma'am. Dustin Gardner, for the record, Deputy Chief County Fire. We are prepared for pre-positioning. We budget for pre-positioning, and because we're a CAL FIRE contract county, we are allotted funds through CAL FIRE, and because of Chief Lorenzen's work at the state level with the D-risk and the governor, we also have additional funds available to the Office of Emergency Services.
Thank you. I think that's very important for us to understand. So,
Are you working with Edison also to coordinate, the power cutting and so forth during the east winds and so forth? Or
They're part of our ongoing regional collaboration as far as information sharing. They're really good about keeping us informed of what they're going to do. They're implementing a number of new situational awareness tools that they're giving us access to for the first time. So our offices are coordinating really well. Truly, it's Kevin McGowan and the sheriff and his Office of Emergency.
that's going to work out great for us, yeah. Working with Edison and Cowan and you, thank you.
well, and I have to say, we have a great three-tiered system. We have our sheriff's, fire department, and OES that work as a team. They're very powerful. So thank you.
Thank you.
All righty. So we're ready to end the speak now or forever hold your peace part of the thing for the department heads, and moving to board member comments before we go to public comments. Any board member comments? All right. Let's go to, we have public comments. We have two speakers, Danny Carrillo, and on deck is Lisa Cody. There you go. On deck is Danny Carrillo, and speaking is Lisa Cody.
Good afternoon, supervisors. Thank you. I'm a research and policy analyst with SUI 721, and I wanted to discuss, obviously, what's going on with the layoffs, but most importantly, I want to address the issue of the study by Huron and its impact on the county. So the budget projections that were given in Mr. Foley's presentation were pretty rosy. A number of you questioned patient days being up by 8.5%, admissions up by 8.47, on and on, that these projections are likely to be realistic and will happen. And Supervisor Parks asked, well, I'm confused because I'm looking at this and our budget's going to increase, but yet we're having significant layoffs. And the response to that was the reason we're still having them, or at least most of the reason we're still having those, is that we want to be in line with the staffing standard in the industry. And at least according to our reports, that was given something like 8 FTEs is what we're at now, VCMC, per your adjusted occupied bed, and that the standard is 4.5. So I have a couple questions. I don't have that report, and I've asked for it a number of times. Hopefully I'll get it. But for that reason, most of my comments today are questions, because I don't have that report. The questions I have is typically when you do these sorts of studies, you look at the individual categories and job classifications and you look at those. So as you know, in California, we have staffing ratios that are required as opposed to the rest of the states, right? There are a few states that have them as well. So that's going to skew your ratios quite a bit higher as opposed to a standard. So again, I don't know what standard was used in the Huron study, but I have a question as to what that standard was. When I looked at the Office of Standards of Health, Planning, and Development, and I actually used that data to look at VCMC, the standard that the FTEs per adjusted occupied bed that was given was 6.22. That's per productive hours, per paid hours, 7.12. When I took the Trauma 2 hospitals in California, publicly owned, and looked at that average, which is at least 4 hospitals that I know of, Riverside University Health System, VCMC, Arrowhead, and Natividad, the average was per productive hour 7.37. So we're actually lower than that average. And when you look at the actual nurse, you break it down, these ratios are added up for all the different like supervisors, technicals and specialists, registered nurses, aides and orderlies, clericals and other admin. You're actually just looking at your nurses and your techs, which are some of the people that were laid off. we are a little bit higher than the average. We're at 1.98 for the techs, where the average for the trauma 2 that I mentioned was 1.62. But there's a lot of factors, and our nurses are actually below. We're at 1.86. The average for the trauma 2 hospitals I mentioned was 2.55. So again, I'm somewhat confused as to where these numbers come from. In addition, I'll also mention that I looked at other hospitals, and we were actually way lower when you take into account teaching, the fact that we're a teaching hospital. So the number went for the averages in the state for around 6 to jump to 9 or 7. So again, it's really important that you look at all these different averages. The other thing I want to mention, I know I'm out of time. I didn't realize it was so quick, is that you have a lot of contracts for staffing nurses, for, for everything, for OTs, for PTs, for clerical, for accounts payable, for radiology
And what's your
techs.
point?
Okay, the
Great,
point
thank
is, you have a lot of contracted temporary employers.
Great, thank you very
Right.
much. All right, appreciate it. Mr. Carrillo.
Good afternoon, Chair Bennett, members of the board, county staff. Danny Carrillo, Tri-County's Regional Director for SEIU 721. I also support what my colleague, Ms. Cody, was trying to present to you. I'm here on behalf of the approximately 3,700 represented employees that SEIU represents. It's unfortunate that I'm here and having to speak on what lies ahead for now that the number is being reduced, approximately 50 people who are going to be now no longer employees with the county. They have families, they have obligations. In a recent meeting we had with Labor Relations, they told us that we knew this was going to happen and we've known it for some time. But yet, I also told them that why aren't we setting up some kind of committees, or why aren't we using frontline staff to come up with ideas? They're the experts in suggesting ways to save dollars and to be more efficient. Instead, it's more like top-down. In a neighboring jurisdiction where we're also facing this potential layoffs, same thing happened. Just recently, last week, they finally came out with an email to all their city employees asking for cost-saving ideas and revenue-generating ideas. Did that happen here? Not to our knowledge. Again, we understand that the hospital's budget has gone up and down through the years, but it hasn't got to the point here where there's been layoffs in this magnitude. In one of your slides, you point out that it's been a collaborative effort, employee effort, maybe throughout the county, but I'd have to question that if it happened at VCMC and HCA. I do want to give recognition and kudos and thank you to Supervisor Zaragoza and to you, Chair Bennett, when we did meet with you and some of our members, and your commitment was to try to do the best we can to minimize these layoffs. And to that end, I do want to recognize too what the county has done in trying to save positions, just like you've shown here. We've experienced this in other departments, including HCA. So we do recognize that, and we appreciate that. It's unfortunate, though, that, again, all efforts were not made, according in our estimations anyways, of how the system could be run better, more efficiently, and also to save jobs. Thank you for your time.
Thank you, Mr. Carrillo. We have concluded our public comments, and we now will have this board will adjourn to 6 o'clock, where we will re-adjourn for a second opportunity for the public to comment on our budget this evening. And I appreciate all the department heads, all the long work that everybody's done for the last few months with the CEO's office. Lots of reports came from the CEO's office over time. I'm hearing this from this department, that from that department. This is where I am. So it's been an ongoing process, and today is simply the final moment in that process. So really appreciate everybody's efforts, and we'll see everybody back here at 6 o'clock. Any board members, right? All right. Welcome back to the boardroom. For those of you that were here before and those of you that weren't here, welcome to the boardroom. We're going to reopen our public hearing on the budget. 6 o'clock. I have one public speaker. If anybody else wants to speak on the budget, this is the opening of the public hearing, and we will close it down after this. David Grau. Good evening, Mr. Grau.
I want to thank everybody for showing. Woo! All right. All right. My name is Dave Grau, Ventura County Taxpayer Association. For several years now, management from the medical center has assured the Board of Supervisors everything was under control, when in fact it was not. Over the last 2 fiscal years, BCMC lost about $27 million and borrowed another $69 million from the general fund. BCMC owes the general fund more than $120 million and is unable to repay that debt anytime soon. Clearly, the public hospitals have a problem. The county invested $10 million in Huron consulting services to improve operating efficiencies. This was supposed to generate $30 million in savings over a year's time. Those savings have never materialized, partly because of resistance at all levels of management. CEO Bill Foley and his new management team are proposing a much-needed major overhaul of hospital operations, which we totally support. The initiatives include implementing Huron recommendations, improving productivity at the clinics, and eliminating excess staffing at both hospitals. Initiatives management should have accomplished last year, but largely failed to do so. Mr. Foley brings new focus to a basic measurement of hospital operations, the number of full-time equivalents per occupied hospital bed. A well-run hospital will have around 5.5 full-time equivalents per bed. BCMC currently operates at about 8 full-time equivalents per bed. Something I think all of us can understand that number. That's way too much, and long overdue adjustments to staffing need to be made. To ensure success, everybody will have to be open to making significant operating improvements. We would like to see the unconditional support of the county CEO's office and the unions. At times, real solutions involve staff reductions. Earlier, Ventura County Taxpayer Association expressed its support for BCMC's 1920 budget because the initiatives outlined a clear path to reducing what otherwise would be a $47 million loss. Taxpayer Association continues to support BCMC's budget, but is concerned that unless the county CEO and the Board of Supervisors fully support all changes that need to be made, the 1920 budget, like so many others in the past, will be doomed to failure. Thank you very much.
Thank you for your testimony, Mr. Grau. Do we have any other public speakers? All right, I'm going to close the public speaking part of this, and we're now moving into budget deliberations, which is item 8 on our agenda. And the first item that I want to cover before we get into any budget deliberations that we have is just one official one that we have to do, which is that the budget adjustments consisting of appropriations, revenues, permanent positions, as summarized on the separate pages, Exhibit A, are hereby adopted for inclusion in the budget. Those are the things that Ms. Mann gave us earlier this afternoon, the adjustments that staff has made up to this point in time. So I'll make that as a motion. And that doesn't mean we can't make all kinds of other motions about the budget, but that motion does need to be made. So when the clerk is ready, there we go. So that's been moved and seconded. We're ready to vote on just accepting staff's afternoon budget adjustments. And we're ready to vote. And now, budget deliberations. Board members. That budget adjustment passed. All right, board members, any budget deliberations? Supervisor Parks.
Yeah, I would like to discuss the opportunity to put some funds aside, as we did a few years ago, to challenge the cities to build homeless shelters. You know, there's a law now that if you don't have a place in your city for people who are homeless, you're obliged to let them sleep on sidewalks, public facilities, and all. I know that is not optimal for anyone, and it would behoove the cities to move forward. They have a little more reason to move forward because of that law, but I also think if we can offer them some challenge grants, we have an opportunity to move that needle a little further towards getting shelters into these cities, and I think that's something we should consider. I voted for it last time we did it, and just found out today with Supervisor Long's questions that the funds that we had put up are no longer there. So I like the idea of being able to set aside the funds, and then, of course, they would have to come and present their case before the board for that approval. But I like the being able to incentivize it to the best of our ability.
I agree with you.
I'm going to offer a different perspective on it. Hope the board would consider. We set aside that $3 million years ago for shelters. And what it did was it led to constant people coming and saying, you got $3 million set aside, the cities aren't building any shelters, let us use it for this issue, let us use it for that. And in fact, that $3 million that was set aside, only $450,000 of it was used for shelter. The rest of it was not used for a shelter. So I think that we actually would not be accomplishing what we want. I think all of us up here want to have more shelters built in Ventura County. We need them. The best way for us to do that, I think, is not to designate a certain amount of money, but instead to follow through on our commitment that we've made. We've challenged every city out there. We said, if you build a shelter, we'll pay for half of the construction cost and half of the ongoing cost. Setting money aside did not motivate one city in Ventura County to step aside, because that was just money for the construction cost. What got people to step forward was when we set money aside for the ongoing expenses. We said, we'll match you with the ongoing side of it, and then we got Ventura and Oxnard. I think we have a much better chance of, if you want to call it whatever, incentivizing the cities if we don't identify an amount of money, but we keep emphasizing that we stand ready to work with every city out there. So I just think I completely respect and appreciate, being somebody who made that motion years ago, I respect and appreciate the intention of what you want to do with it. It's just, I think because we have so much more of a homeless issue in my district, I can tell you, if we do this, I will every couple of months have a major organization coming forward wanting that, and it's really hard to say no. Even though the money was designated for shelter, it got frittered away. And I think we're far better off with our current thing. We have demonstrated that we will follow through if a city steps forward. We voted for it with the city of Ventura. We are actively working with the city of Oxnard. So again, I appreciate it. Sorry I can't agree on this one, but I think we actually are making a fiscal mistake if we do this.
Well, let me give you a different perspective on that. If I remember the conversations from the board meetings in the past, we talked about how, yes, it did get dwindled because it was going to the emergency winter shelters and so forth, and we weren't specific enough on permanent housing. And then there was a push. We took people down to the county of Orange to talk about all the different changes they were doing. We came back. There was a lot of discussions yourself and Supervisor Zaragoza had with the other, with your cities, making sure that there was going to be some conversation about a dual county city permanent shelter. And I think once we changed the revenue side, that it then was, look, we are serious, we need permanent shelter, and therefore that big push to it. So the line item, just like with bike lanes, at a 1.9, we are not using that, anything except for putting in bike lanes. I think to put in from our reserves as a line item for permanent housing, it is not saying that it has to be used. It's stating that it is there for the purpose of doing it as an initiative, just like the bike lanes are. I would suggest, we had it in the past, it was a 3 million. I would like to consider a 2 million. What it is it's moving it from the reserves to a line item specifically for permanent homeless shelters, and be more specific so that it doesn't dwindle away. Because I agree, if you just say it's for homelessness, it can be used and cut and diced into many different things. But I prefer to have it very specific into the homeless shelter, permanent shelters.
Well, I respectfully disagree in that when we set the 3 million aside, it was not for winter warming shelter. Winter warming shelter was not to construct a shelter. That was for ongoing cost of a winter warming shelter. That was ongoing money. This was $3 million set aside specifically for permanent shelters. And it got frittered away, even though that's what it was designated for. So we're doing the exact same thing we did then, and it got frittered away.
Mr. Chair.
Supervisor.
I'm not sure if we ought to set a limit on how we can help the city of Ventura and Oxnard by putting an amount. I think that people would kind of look for that amount as opposed to finding out what's the best funding that we can get for our partnership. And if we need $1 million, $2 million, $3 million, the reserves are there. I don't think we have to have a limit or an amount set aside for that, because it's working out, and we have a partnership now with Ventura and Oxnard. So I don't think we need to put a limit on what.
I think Supervisor Long made a good point that I do recall. What we did with that funds is we put it into temporary shelters just so we can get them open.
And it was used for
It's
other.
up to the Board of Supervisors to do that. If we put this, and I really like the idea that it's for permanent shelter, it's not for a temporary foul weather shelter as it was used for before. And yeah, I think 2 million. And what it does is it's there as an incentive, and it's a message to the cities because they need to step up, the ones that haven't already. And we have had some good success with both Oxnard and Ventura. So I'd like to go ahead and make.
But then, can I share something with you? If the cities know that we have $2 million in there, their funding is going to be limited to our monies, as opposed
Well, it could be that we
If I
can do
could-
more, but I would like to make it a motion if I can.
Go ahead, Supervisor Huber.
Yes, I just wanted to say that there are cities on the east end of the county that need shelters just as much as the ones on the west end. So we're going to spend money. I want it to be equal between the west end
And
and the
I
east end.
agree.
So the
100
reserves are there for that.
Mr. Supervisor Huber, I agree 100%. When we passed the resolution saying we would pay 50% for both the shelter and the ongoing costs, we did not put any money into a homeless shelter fund for that. We had already squandered 2.5 million of the 3 million. It was gone. I shouldn't say squandered. I mean, it was not used for a homeless shelter.
Other than that. Yeah.
So but when we did that, we didn't put money in, we didn't put new money in. And yet we started allocating money out of our assigned reserves. So this is not about, oh, we did it for the West County, not the, I very much want it to happen in the East County also. I just think the best way for it to happen in the East County is to actually not designate it for homeless shelter, because when we did that before, as Supervisor Long and Parks pointed out, the board ended up, even though it was designated for a permanent homeless shelter, it ended up getting used for winter warming shelter, for other things, not just winter warming shelter, but a lot of other things. So you increase the chances of that happening, you decrease that by doing it. Either way, the board wants to have homeless shelters in every city, and I'm completely committed to that. I just think that's the best way for us to have that happen, is to not designate it. It's interesting.
And the cities will look at that money and figure, hey, well, the county has $2 million. Why should we budget any more dollars than that, as opposed to working with?
Well, the only reason I said it the way I did is because two members here said the cities of Oxnard and Ventura.
Well,
Yeah,
that's
we need
There's
it.
other cities in this
This would
county.
be Supervisor Zaragoza, this would be a matching fund. That's why they would do it.
It was a matching, the $3 million was a matching fund.
That's right.
The $3 million was a homeless shelter matching fund for a permanent shelter, and it didn't get used that way. And the only reason, I mean, Ventura and Oxnard have stepped forward, but if Simi Valley would have stepped forward first, we would all been there for
Would
Simi
have done
Valley
it
too.
accordingly.
It's the fact that we have out there two things. One, a motion passed by this board saying we will support cities 50% of the ongoing cost and the shelter cost. And two, we've demonstrated we'll actually do it. We'll take money out of our reserves and actually do it. That's what's going to actually give cities the incentive.
But I think,
The money will be
I
there.
think I have to state, the votes and the way we spend our money is the vote of the board. So we didn't just squander it. The board, whoever, whatever year was, they voted to spend that reserve at a certain way. And so I believe, similar to just a random reserve, is to make sure that you know line item, how much you're spending. It's a tracking mechanism so that you understand how much you're spending on your homeless permanent shelters. I want to make sure it's transparent versus, well, we just took it out of the reserves and we just keep taking it out of the reserves. I want to be able to tell the public how much we did spend total on homeless permanent shelters. That way we can utilize that, and if that way we can utilize it to get more grant funding from the state or so forth. But if we just keep remembering to add the projects together and how much we spent, it's more transparency from where I'm coming
And the
from.
board will
We can
decide
still-
it in the end either way. When
Right.
they come in and want some of the $2 million set aside, the board can decide. And if the board doesn't want it to be used for its intended purpose, which is what we're saying right now, which is for a permanent shelter, that's a decision of a future board. But this specifically is for that.
But if the money comes from reserves or from the allocated amount, we still have to keep accounting for it. We still have to account where the money's going to.
Well, I corrected myself. I misspoke when I said squandered, because what I meant to say was not used for what the intended purpose was. And
That
being,
fault is ours.
exactly, and being from a district where a lot of people working on the homeless issue kept coming forward, I would offer to you, if you set it money aside, they will keep coming. And if you don't, then it'll really be just the 8 cities that are left that will sort of have an entree to come, because there's no money set aside. But as soon as you set that side of money, that money aside, you're going to have people from the cities of Ventura and Oxnard that already came. They're going to say that money's set aside, and nobody from Thousand Oaks or Simi's claimed it in the last 6 months, so I want it. And that's what's going to happen. That's what I think. But I think we've probably had a healthy conversation about it. I don't want to belabor the point here, right? All right, I think we're ready to vote.
And again, it would be $2 million for permanent shelter as a match to the cities.
All right, and that motion passes 3-2. All right, congratulations on getting that.
Mr. Chair, can I just get a clarification? Was the motion for a specific amount of money?
$2 million.
You know, any recommendations before it becomes, this should be considered a straw vote? Any addition or adjustment to the preliminary budget has to be in writing. So staff will have to put it in writing and
She
share
has
it with
it.
the auditor and
Okay,
show exactly what account it's coming from and all of that.
great. Well, staff will do that while we have any other budget deliberations. Do
And
you have any
actually,
other?
Our auditor has that available for us in writing.
Right.
Any other budget
So
deliberations?
the motion would be considered to be a direction by the Board of Supervisors to do that,
For staff to
Under,
write it up.
the Budget Act allows you to take straw votes.
right?
Then at the end of your deliberation, here, it may continue with other items. The straw vote is just, preliminary. And then at the end, you have to take a final vote. And to take the final vote, the proposal has to be in writing. It can just be handwritten but circulated. So it's a straw vote. It's more than direction to staff. That is, I interpreted that was a straw vote to adjust the budget to include $2 million in
Just-
some kind of reserve fund. I'm not sure exactly which fund.
And could they, Kay, would you mind coming up to the podium?
We just want to make sure it's very clear.
So what I have here is that board direction is to transfer $2 million from the assigned, it's program mitigation account to an assigned homeless, it's permanent shelter match account. Is that
Yes. For the amount of $2 million.
$2 million? Yes.
And Ms. Mann, if I can just ask you, can you identify for us how much money we're spending on the Ventura homeless shelter? You have
We
those
had
numbers. in front of you.
800 and I believe 30,000.
I just want to make it clear,
plus-
even though we didn't have a homeless shelter account that came out of, we have very
Correct.
clear tracking of how much money we're spending
Yes,
on the
very
homeless
much so.
shelter. in Ventura.
Yes.
Okay, all right, great, thank you.
And how much of that
But-
came from the homeless shelter fund?
Yes, 450,000 came from the homeless shelter fund to this one-time amount. So the remainder out of the 831 came from just the reserves.
And all of the money from the
Actually,
Oxnard
it came out of
effort,
contingency, but
Contingency, okay.
and all of the money from the Oxnard effort was going to come out of that other fund.
program mitigation,
Now
it will come out.
Now it
they
will
come.
come out of this fund.
But regardless of where the money comes from, we're going to have to be accounted for.
That is
Whether it's
correct.
a set-aside
Yes.
money, whether it's reserves, we still had to do an accounting for it.
And
Most
we will-
definitely.
And we'll still have to come up with the ongoing funding, which
That is
not
correct.
ongoing.
Yes.
All right, thank you very much. Do we have other budget deliberations?
Chair Bennett, Supervisor Parks had raised a question about the litigation accounts. We just have some follow-up information if you'd like, so maybe Brian.
Yeah, a question was asked earlier today about another assigned account, and you've just created a new assigned account. There's an existing assigned litigation account. It has $369,000 in it. That account, my understanding of it is it's used exclusively to backfill a county council budget line item if the amount that's appropriated for those two line items are exhausted. Then this account can be used to backfill that without coming back to the board for approval. And those two accounts are for outside attorneys or other professional services, which means experts. So if we have to hire outside counsel to represent the county and/or spend money on experts, I forget we have about 110,000 total in those two line items. And if we need to, the county can backfill us out of this assigned litigation account. That's all that account is for.
Thank you.
Anything else under budget deliberations? All right. We now need to file the written description or deliberation adjustments, if any. So do they need to be actually filed? All right. So they're now filed. Clerk, have you received them in writing, or no? Ms. Mann's going to hand them to you right now. And now we're ready for a vote to adopt the deliberations, the adjustments. So it's been moved and seconded to adopt the deliberations adjustments, and we're ready to vote. I'm going to vote for it since it's clear where it's going to go in the interest of collegiality and saying we're all on the same page here when it comes to trying to get there, just different path for getting there. All right, and I'll close the public hearing. And now budget resolutions.
Passes.
Motions to adopt budget resolutions, including the GAN limit, Proposition 4, and Laura's Law resolutions as follows. Move approval of the resolution adopting the Ventura County General Fund and other funds budgets for fiscal year 2019-20, the GAM limit, Proposition 4 resolution, and Laura's Law resolution. 2, do I have to do those separately, each motion? No, we can do it all. Good. 2, move approval of the resolution adopting the budget for the Ventura County Fire Protection District for fiscal year 2019-20. And 3, move approval of the resolution adopting the budget for the Ventura County Watershed Protection District for fiscal year 2019-20.
Question? Do we need to have any motion to make sure that the CPA update is going to be presented in the next quarter? It was discussed, and I want to make sure it's followed up on.
I certainly don't think that's a budget.
Okay, I want to make sure clear.
Yeah.
Yeah, I said that we will.
Okay, thank you.
It's been moved and seconded. We're ready to vote on the budget. In 6 hours, we'll have the vote on the budget recorded. What a time to freeze. Seconds away from relieving all these people.
We're upgrading our system, right?
No, we can do it.
Let's just do the vote. Let's just do the,
Yes, the verbal vote?
is there any objection? That's unanimous vote of the Board of Supervisors. We now have final board comments. I just would like to comment on behalf of the board. I know that the CEO analyst, along with Mr. Powers' office, has to interact with the department heads of 23 different departments out there. Those 23 different department heads have to work with their managers to try to come up with all of the arguments, information that's needed to try to pull together budgets for all 23 of those budgets. We are truly blessed in Ventura County to have a budgeting process that is thorough and professional like it is, and to live in a county where we have a budget that is in as good a shape as it is. And we have one department that we're all going to work hard on to try to make sure that that department's budget improves dramatically next year. But I think the citizens of Ventura County have been served well by the employees of Ventura County from the bottom to the top in terms of trying to make things work. And so I just want to say thank you to everybody that works really long and hard to get us to this point. I really appreciate it. Any other final board comments?
Mr. Chair, I also want to thank all the agency directors for all the extra work that they've done, and to Mr. Foley, please try and find work for the folks that are losing their job. And it's important that we take care of those families. They have to pay the bills, they have to raise their children and so forth, and it's important that we help them out as much as we can. And thank everybody for all the excellent work that they've done. I know that we have a lot of agency directors, a lot of good people that work for us, and I just appreciate that tremendously. Thank you so much for your excellent work.
Supervisor Parks.
I also want to say thank you, but it also looks like we have a very exciting year to come. There's really good budgets and neat projects that the county is working on, and I'm excited to see where it all goes next year, and this gives us some really good direction. And also thank you to Mr. Powers for his leadership on this.
All right.
I would agree.
Supervisor Long?
Seeing Mr. Powers running between offices and phone calls today, it just shows how much you care about the county. So I want to say thank you. And to also all the department heads, I think you'll sleep easier tonight. Finally, it's over. I know this is a very large endeavor to do. And then tomorrow we start on to the next projects. So I just want to say thank you very much. Hope that you just take a minute to celebrate with us for a good budget. Now we just have to work hard and get those projects done. So thank you for all your efforts, and please relay that to your staff as well, to thank them too for all their hard work, because I know it's a big team out there. So thank you.
Anybody else? Mr. Powers.
Thank you, Chair Bennett, board members, for those nice comments. And really, it is this team. I'm so pleased there's such a good turnout of the leadership team, because you can see it's the department heads, but it's their financial officers as well. There's a lot of detail and analysis that goes into this crunching the numbers, getting them right, and being able to explain them. So I just thank you all for your hard work and bringing all this stuff together. Our department heads, our elected officials, our auditor controller, Jeff and his team. It's not every county where the elected department heads work as well as they do with our office and with your board. So we are also blessed in that way as well. The state more and more puts more pressure on counties to do services, and we like to do that because we can manage them better, but we don't always get the funding that we need, but we're not victims, and we manage it effectively. And I see our safety agencies managing safety realignment without adequate funding, but you don't hear any complaining. They just do a great job day after day. So really appreciate our sheriff and probation and DA and PD and all that they do, because you don't hear a lot about it, but that's a big deal. And that's why it's such a safe county that we live in. The healthcare, and certainly appreciate Mr. Grau's comments, and glad you agree. We obviously fully support Mr. Foley. I told him he has 1,000% support. We'll make it 2,000 now. But we really know that he's heading in the right directions with some difficult decisions. These are hard. The RIF decisions in particular, the reductions in force. Those are as a last resort after other initiatives in terms of productivity and revenue capture and access, and all those things are being, but these are the kind of changes that are going to keep our system strong on into the future, and we have to do it. And I think your board's been very supportive of all those efforts, of the Huron initiatives, funded the Huron contract as well. And I don't want to get lost in all this too, that there's really great healthcare going on every day in our system. The quality of our providers is truly second to none. And I'm super proud of them, as I know your board is. Just the great care they get recognized for it constantly, both nationally, and then we hear great stories of the care that they get in our system. So just appreciate, I know they're going through some tough financial times, but we're going to get through it. But the quality of the people and the quality of the care that they provide is second to none. So with that, again, I just thank you for your board's constant, unwavering support for the tough decisions that these great managers have to make. And I would say this is the budget. But there's not just a budget, they manage to that budget and well. And again, last year they did great, the year before. This year they're going to come in way under budget again because they do such an excellent job of managing their budget. So with that, I'd say thank you very much.
Go home, have fun. Thank you. Meeting's adjourned.